Recently, the World Health Organization released a report that predicts that by 2020, fully 3/4 of all deaths in the world will be attributed to chronic causes. Hi, I'm Brian Saul. I'm with the eCW'sPodcast, and in this episode, we'll be discussing chronic care management with Dr. Pavan Anand.
Thank you.
Pleasure to have you here, sir. And he is from the Naples Internal Medicine group here in Naples, Florida. The program we're going to be talking about is a program that Medicare and Medicare Advantage plans put in place this past January of 2015. Essentially, the program allows providers to bill approximately $42 per patient for seeing them on a non-face-to-face interaction basis. Now, that is not an insubstantial amount of money. For example, if you have a patient census of 100 patients enrolled in the program over a year, that amounts to about $50,000 extra dollars in revenue. We're going to talk about the program a little bit today, as I said, with Dr. Anand. And first, Dr. Anand, would you mind telling us about your patient population, the patients that you serve in this area?
So being here in Naples, Florida, we have quite a few older patients, though we also have a mix of patients who are middle-aged in the ages of 55 to 65, but a significant portion of my office visits and time spent are with patients who are over the age of 65 who do have multiple chronic problems, medical problems.
Recently, I've been traveling a great deal around the country and speaking with many, many physicians. I'm very surprised at how few physicians know about this program. How did you learn about it?
So the Medicare decided to try this out in 4 or 5 pilot areas. One of the pilot areas was in upstate New York, and I had a colleague, an old friend, who actually practices in family practice up in that area. He was part of one of those test programs, and he was being reimbursed those $42 per month and had a significant Medicare population. He has been doing it with Medicare for over 3 years and has had a successful interaction with Medicare with this plan. And he was keeping me abreast of the new changes that are coming about, and when they came about in January, I was very excited.
I can imagine so. Can you give us a brief rundown of exactly what type of patients are eligible for the program?
So any patient with 2 chronic problems, medical problems, we generally are looking for, in our practice, for patients who've been in the hospital with chronic medical problems, such as patients with diabetes, hypertension, heart failure, strokes, any type of vascular problems, or any type of health issues such as heart failure that they would frequently go back into the hospital. So we're trying to keep them out of the hospital and also have a better sense of well-being. That's the second group of patients that we're really seeing who really embrace this. Patients who are a little bit overweight, who have a little bit of diabetes, a little bit of hypertension, and a little bit of high cholesterol. They really react well to services where we can keep them a little bit lighter, a little bit on less medication, and with a little bit more human touch in this digital world, and they really respond very well to that.
So the patients on a whole are responding very well to the program?
I would say over 90 to 95% of our patients really are actually happy for us here in the office to be part of that program.
Now, one of the things that it is necessary for a participant to be in the program is they need to pay an $8 monthly copay. Have you run into any issues with that?
So, generally speaking, $42 is billed monthly if we spend more than 20 minutes per that month. Medicare covers 80% of that, so there's generally an $8 amount that's required for their secondary insurance or that they'll be responsible for. A majority of my patients, over 90%, have secondary insurances, so while they know that there's a secondary cost, they don't necessarily pay it directly. The patients that do pay it directly are actually enthusiastic about paying because they realize all the time we spend prior authorizing their medications, making sure their medications aren't interacting from medications that are prescribed from other physicians.
So a lot of what you would do then during these interactions is med reconciliation? Is that a large portion of it?
So we've broken down, since it started in January 1st, into breaking the groups of patients who are in chronic care into 3 groups. Patients that are in the hospital that require more than 20 minutes. We have a significant cohort that are patients who require 45 minutes or more per month on a recurring basis. And those are the patients that are going to need more intensive care, perhaps a dedicated person such as a nurse practitioner or an RN in their cases. People who require less intensive care, who are requiring 20 to 40 minutes, perhaps would need an RN, and patients who need less than 20 minutes, who intermittently require a 20-minute interaction every 2 or 3 months, we're finding maybe a medical assistant can work with them.
Do you ever use any ancillary services, folks? Dietitians, PT, OT?
So certainly we use a tremendous amount of physical therapy and a decent amount of nutrition. We're also using a little bit of alternative medicine that we found to be very helpful and with a lot of patients. Some things such as yoga has been a good addition. We don't provide the services, but we help direct them where they can use the services to their benefit.
That's fantastic. Very innovative. Now, we were mentioning that some of your patients take the 20 minutes, some of them can be a little bit more. Prior to getting into this program, however, did you find yourself still spending that time with the patient, just not being reimbursed for it?
So we basically have been doing a lot of this work already. We just had not been reimbursed. And now that we're having time to be reimbursed, not only can we provide more services, we can provide more comprehensive services so that down the road, nutrition counseling in groups of people might be something that might be beneficial to people. So we're actually finding that we're having a little bit more interaction with patients now, but we certainly were doing a majority of this work prior.
We're going to take a quick break now. When we come back, we're going to continue to talking with Dr. Anand about his journey so far with CCM and get a little more specifics on how he actually does it. Stand by.
Join us in Nashville, Tennessee for the 2015 eClinicalWorks National Conference, October 16th through the 19th at the Gaylord Opryland Resort. Join over 4,000 eClinicalWorks clients just like yourself as we take the national conference to new heights. Our event schedule in Music City is jam-packed from start to finish, kicking off with a keynote and product showcase by CEO Girish Navani at none other than the Grand Ole Opry. Follow that with over 120 breakout sessions, on-site support and training centers, and an exhibit hall with the latest and greatest in eCW innovations. Don't delay. Register today and take advantage of early bird pricing until August 14th, and make your room reservations soon as space is limited. We can't wait to see you at this year's conference, where we'll be kicking up our heels in Nashville, Tennessee.
Welcome back. We're talking chronic care management with Dr. Anand. Doctor, can you tell us a little bit about the process that you have for creating and maintaining care plans for patients?
So the first thing we do is we try to get patients to understand what this chronic care management is, that we have to usually develop a plan, we usually have to develop protocols that we utilize through eClinicalWorks to contact them, to make sure their medications are reconciled, to make sure that they can communicate with a specific person in the office, and to do whatever is necessary for some of our patients to keep them out of the hospital, or at least decrease the frequency that they go to the hospital. The second group is that we're trying to do things that improve their sense of well-being, be it some type of biofeedback with yoga, nutrition counseling, weight loss, using apps to help them lose weight, and that has worked well with a majority of the chronic care management patients. That we have seen to be very helpful. Within the eClinicalWorks platform, there is a space where you can make a care management plan. We usually make that plan once they come out of the hospital and also during their physicals. Medicare allows a once-a-year physical, so we usually do a care plan that we put into eClinicalWorks, and we also put it in after any hospitalizations. Goals such as, an example would be a heart failure patient who just got out of the hospital. We would put goals on what their weight goals should be, what their nutrition goals should be, what they should be eating, what medications they're on, what medication reconciliation we may have to do with cardiologists or EP specialists or any other of the modalities that may also be seeing that patient. Many times they end up being on medications that cause renal insufficiency. Sometimes adjusting their medications makes many of their lab abnormalities improve. So they see in their lab results definitive benefits, better sugar control, and they see that they're no longer going to the hospital as frequently.
So you are seeing very positive outcomes from this, lower readmit rates, people getting well faster.
Yeah, we've definitely seen about a 20% to 25% reduction in hospitalizations.
About how many patients do you have enrolled currently, if you don't mind my asking?
Currently we have 950 enrolled. The ones that are enrolled, the ones that actually are utilizing 20 minutes a month are approximately 400 to 500 a month. And they are the ones that are fairly consistent. Of those 400 to 500 are about 350 to 400 who have consistently been using 20 minutes a month or more since January 1st.
Have you had to hire more staff to accommodate those patients?
We are in the process of hiring more staff and delineating the groups that are requiring more time for their care management to have specific contacts within the office, and we will be continuing to hire more staff, yes.
What's your recruiting plan like to actually get these patients into the plan?
Most of my patients, when they come in, we've been educating them when they come in for their office visit what this plan is, and we've been signing them up since mid-December when we knew that this was going to go into effect, and we've been doing that as they've been coming in for their office visits. Obviously, we have not been able to enroll them until after their office visits and bill them, but it gives them some time to look it over, ask us some questions, and it helps us explain things to them.
It seems to be successful with that number of patients enrolled.
It is quite successful. We have not used internet blast or any email to contact them because we felt it would be more important to interact with them one-on-one so that they're aware of the financial costs and so that they're not surprised by anything.
Could you walk us through sort of I don't want to say soup to nuts, but the process that you go through from getting the consent of a patient to actually dropping the bill for $42. Could you just give a brief overview of how your office handles that?
So usually the first thing is when a patient comes in for their regular office visit, we give them some time extra to explain to them what a chronic care management plan is. We generally ask all of our patients who are in Medicare to be aware of what it is, and we then have them bring in that paperwork after they've been educated a little bit into the exam room with me. Then we go over their health problems, and if they do have two chronic care management problems, be it diabetes and heart failure, we would certainly set them up. So let's say I hadn't seen a patient since early December, we would certainly have them come in for their physical, and they were coming in today. We would educate them about the chronic care management with my receptionist and have them come into the exam room. In the exam room, they would ask me if they had two chronic care management problems. Clearly they would if they had heart failure and diabetes. We would set them up during their physical with a care plan that we would then implement and put into the system. The care plan, which does not count as part of the 20 minutes that is entailed for this chronic care management, would then be placed into their separate area within eClinicalWorks. Then any interactions they may have with other providers, specifically nephrologists or their cardiologists, where they may have competing medications which may cause some drug interactions, they can let us know what's going on, and we can also be aware if they have had appropriate testing for those medications, that their lab testing has been up to date or any other testing is up to date. A majority of my patients, 50%, use email, and so they do email into the office, and when they have a dedicated person, they will be able to then interact with that person more clearly.
Are they emailing through the patient portal, or is it a direct email into the office?
It is through the patient portal, through eClinicalWorks, and it just seems to work really well. While these are Medicare patients, and I certainly have my spectrum of 65-year-olds to 103-year-olds, still we've seen generally about a 50% implementation rate through the portal with email. They prefer to use email because they're busy, traveling, golfing, and they can access it when they're ready.
Great, that's fantastic. We talked about outcomes a couple of minutes ago. You had shown me a chart that you had put together from prior to actually using ECW. Would you mind talking about that?
So we've noticed that as part of nationwide data and data from CMS, 2 out of 3 Medicare recipients have 2 or more chronic care problems. And those chronic care problems become more significant in the population as they age. So generally speaking, patients who are in the 65 to 70-year-old cohort generally have patients between 65 and 70, 20 to 25% of them have 2 or more chronic conditions. And as they go up each 5-year cohort, that number goes up to 30, 35, 40, and above 60% once they get above the age of 80. So they certainly utilize it, which they've always utilized. And then now we are able, as of January 1st, to bill for the things that we've always done and provide perhaps a little bit more services.
Mm-hmm. How has ECW helped you in this process?
The main thing that ECW has done is been able to, one, put it into an electronic environment that allows anyone in the office to access it. For instance, if we have a dedicated person dedicated to that patient, they can pull up my care plan and they can review what their dry weight is for a heart failure patient. They can review what medication changes were done recently or insulin changes were done recently for a diabetic. And we can track all of these changes and any questions they may have. Any drug interactions that they may have will also come up, and they will also then be, if a question was delineated to a specific person in the office, if that person couldn't answer it, they could always ask me or ask my nurse practitioner.
Okay. If you had to tell another provider 3 things about the program, 3 things they should avoid and 3 things they should absolutely do, could you possibly do that?
So 3 things I would do would certainly try to get everyone educated about it. So every one of your Medicare patients should be educated about it. While we've educated everybody doesn't qualify. Many of my patients have 1 or less chronic care problem, and therefore they don't qualify. But a majority do qualify for chronic care management. If they're educated and they're 66 years old, when they're 72-year-old and 72 years of age, they may develop a secondary problem and then may qualify. If they're educated early on, down the road, this will be easier to show them the benefit. The second thing I would definitely ask people to do is use the eClinicalWorks electronic platform, because you can consolidate everything in one spot. And the third and most important thing is to use the time management module. So it dedicates times that you're normally out of habit just took care of things. You can now click on a button and use that time period to count towards those patients, the amount of time you've spent. Things that I would avoid are wordy care plans. I would try to keep your care plans to very straightforward, so you don't have a long care plan that's going to, every time someone who's dedicated to that patient is going to have to read for a minute and a half to figure out what the plan is. I try to keep the plans very simple and very straightforward. Other things to avoid are to have too many goals. So some patients who are obese, who have diabetes, who have heart failure, if we can just have one goal to get them to exercise or walk to pick up the newspaper every day, that would be beneficial. Those are the 2 things I would avoid.
Is there any reason not to join the program?
So when I've talked to some of my colleagues, the main fear with this program is that they're going to have to hire more staff and resources. And I think it has to be a personal decision within each office. If you are going to expect to have 300 to 400 Medicare patients, you can subsequently keep the same amount of staffing that you'll have. If you expect to go to more billing than 300 to 400 per month, then you're going to need to hire more staff. Having said that, if you hire more staff and your expectation is that it's going to be more than 150 more patients above that number, let's just say above 500, you're going to make up their salary and costs and resource fees. So
Be sure to tune in again for more ECW podcasts. You can find them on the ECW YouTube channel. You can find them on iTunes. And of course, you can find them on my.eclinicalworks.com. If you have any questions or are interested in appearing on the show, please write to us at podcasts@eclinicalworks.com. I'm Brian Saul. Thank you so much for joining us. And again, thank you, Doctor, for being with us. Have a great day, everyone.
For questions on CCM, contact eClinicalWorks at CCMSales@eclinicalworks.com or register for one of our free CCM Introduction webinars on my.eclinicalworks.com.
This broadcast and its contents are the sole property of eClinicalWorks and are protected by federal law and international treaties. You are strictly prohibited from making a copy of, modification of, or form of rebroadcasting or re-encoding this broadcast without prior written permission from eClinicalWorks Public Relations, except as may be permitted by law. This broadcast is provided for informational purposes only. It is intended as a personal, non-commercial use. Product specifications are subject to change without notice. Please contact eClinicalWorks Public Relations with any questions. eClinicalWorks V10 EHR is ONC HIT 2014 edition certified as a complete EHR. eClinicalWorks V10 CC 2014 955447-1.